Welcome back. You are watching Fox News at 4. We appreciate that. And you know, when it comes to your children, watching them go through different stages, especially puberty, can be difficult, knowing about all the physical but also emotional changes that they are experiencing. So today in You're Making the Rounds, we are speaking with Dr. Nina Ford Johnson from Infirmary Health about puberty and also how it can affect not just your child but parents as well. Thank you so much for joining us for this conversation.
Thank you for inviting me here. I'm glad to be here to talk about it.
So I want to start off first with the emotions, because it's a lot from a mother or father's perspective to watch their child.
Yes, it is, but it's also exciting. It's a stage that every child must go through. And so the reason why we're doing this talk is to plant the seed so we can keep the lines of communication open between the child and the parent, so everybody will know what's going on.
How do you start that conversation though, and at what age?
Yeah, oh, good question. So to me, I kind of start early, so 7 or 8, and then from then on, puberty, we can talk about that until they're out and have graduated from my practice. So it's always a process.
And that's where pediatricians can come in too, and helping families when they're in for those annual visits per se.
And thank you for saying that, because we love to see our kids every year. That's so important, so we don't miss anything along the way. But education, that's what it's all about.
And we were talking about how school is getting ready to start back up soon.
Yes.
I can't believe it. So we're talking about vaccinations, immunizations.
Correct.
What do you want parents to know?
That the vaccines are very safe. It's something we want to protect our kids against, from the flu, from COVID to cancer. And so it runs the gamut of it all, but it's all very safe, and all we want to do is protect the child.
A lot of kids are active in sports too.
Oh, yes.
And different schools have different rules as to what's required.
Right.
But physical exams are usually one of them.
That's correct. That's correct. And you would be surprised what we can pick up on a physical exam. So that's why it's so very important that we see a child every year for their checkup.
Going back to puberty and helping your child recognize those physical changes, and then being able to help them with the mature emotional side of it, you know, what advice would you give moms and dads out there?
Yes, to take a deep breath.
Yeah.
That it's going to be okay. It gets better. To keep the lines of communication open, and of course, whenever in doubt, always feel free to talk to your pediatrician about it, or your family physician. That's why we're here, so we can plant those seeds and talk in an open, non-judgmental fashion.
Right. I want to make sure that we get all the information out there while we have you,
Yes.
because school is starting soon. Is there anything else you'd like to add?
Yes. Again, to come in for your annual checkups, make sure those shots are up to date. Make sure you get your medication refills ready for school, and your school forms all filled out, so you don't have to wait till the last minute to do that.
Good reminders.
Yes.
Thank you so much, Dr. Ford, for
Thank
stopping
you.
by.